Thank you for listening to Mormon Sex Info. This episode is an archived episode and is only now becoming publicly available. Mormon Sex Info relies on contributions. To contribute, please visit mormonsex.info. And now, please enjoy this episode.
Hello and welcome to Mormon Sex Info. Today I am so pleased to have with me Dr. Stephanie Buehler. She is a psychologist and sex therapist who works out of California and is very involved as a certified sex therapist and in that end of her practice. And what's fun about Stephanie is that she was my supervisor as I became a sex therapist. So we go a ways back, and I've just really always enjoyed her, and we've done a few podcasts in the past before about different topics, but today we are here to talk about infertility and how going through a process in your relationship where you're dealing with infertility can have an impact on your sexuality and your sex life and your partnership together. So I'm really excited to talk about this topic. I think it's a really important one. Dr. Buehler, you want to introduce yourself further?
Oh, sure. Well, first of all, I am very happy to be on the podcast with you. You're right. We go back quite a ways, and we always have a wonderful time when we talk together. So I'm very happy to be interacting with you in this way. So I have a private practice, and I'm co-located with a hospital clinic. So I have the Buehler Institute, which is my practice, and then I'm co-located with a clinic that's called Womanology Restore Him at Hoag Hospital, with offices in Newport Beach and Irvine. And let's see, what else? I'm the author of a textbook called What Every Mental Health Professional Needs to Know About Sex, and the second edition is coming out in November. And then I'm working on a book now that will come out next year called Counseling Couples Before, During, and After Pregnancy, Focus on Intimacy and Sexuality. And it's quite a task to write this book because there's not that much written about what happens to couples as they go through this process. I really have to dig for information. But I'm also going by my clinical experience of treating couples that are facing infertility.
I'm thrilled that you're writing this book. I think it's going to be super necessary. And I know that this is particularly something that with Mormon couples I work with can be extremely painful. Infertility, I think, in general is extremely painful. But on top of that, adding the layer of a faith tradition in which family is so important and wanting to start a family is so important, can add a complicated layer to that. So I'm very excited to dive in with you on this. Yeah, so let's do that. So why don't we start with what you know about maybe how often this tends to happen, or what statistics can you share with us about infertility?
Because people are delaying getting married and delaying starting a family, the numbers have gone up over the last decade or two. And actually, about 5 to 10% of couples will struggle with infertility for one reason or another. And that encompasses a lot of people. And it can be a very shocking and distressing thing to find out that one of the things you wanted most in life is going to be a challenge for you.
So there is something to this idea that the older we get, the less fertile we get?
Yes, and I will say that I remember watching a news show, I think it was 60 Minutes, it was a number of years ago, and the reporter was going around to women in their 20s who were in college and asking them, well, when do you think you want to start a family? And they all said, well, I plan to get married at about 35 and then start my family then. Well, that's a problem because once you hit the age of 35, for a woman, you have fewer eggs and the quality of your eggs goes down as well. So, and a lot of women actually don't know that, or don't realize how real that statistic is. And so we have a lot of couples facing problems that they didn't realize they were going to face.
Which is difficult because I think in this day and age, most people want to feel financially stable or at least somewhat prepared to have children before they have them. They want to prepare for that stage of life where they can maybe be more confident, right, in that ability.
Yes, so we get kind of a double message that it's, like it's good to wait till you're a little bit older to get married and start a family, just for those reasons that you described. But we also risk having difficulties becoming pregnant. And, it's not true for every woman, but it's true enough that women need to pay attention, men need to pay attention to that statistic as well.
And is it also quality of sperm that changes with age, or is that a different type of problem?
It's different for men. Men, the sperm quality doesn't change with age. There can be problems that come up because of using certain medications or recreational drugs. You can slow down the sperm, what's called motility, and it can also change the quality of sperm. But for the most part, if a man is fertile, he will stay fertile. He can stay fertile into his 70s or 80s. And I think Mick Jagger just fathered a child with somebody. So there you go.
Do you think that there are pressures to become pregnant? And if so, where do those tend to come from?
Yeah, that's a really good question, actually. We get pressures from many different places. Often parents are pressuring uh, their offspring to have grandchildren. They want to see their grandchildren. Maybe their friends are having grandchildren. They may come from a culture where having children is a sign of adulthood and also prosperity, that you are able to afford to have children, that you're normal, that you have a body that works, an adult body that works. So, family is one place. Our society also pressures us in a way because we have many images of happily married couples having happy children, whether it's on commercials or in movies. And so we think that the key to happiness is to have children. Although the fact is that people who remain child free actually have higher levels of marital satisfaction than couples that have young children. But this still persists that people want to uh, have the experience of uh, reproducing and enjoying having a family.
The stats are not necessarily for a lot of these things. I mean, the research shows that the older you marry, the better you do, the less children or no children, the better you do as far as happiness and less stress, right? And so that kind of goes against what most of us are doing. But, well, and especially in Mormonism, it's part of our purpose of life is to have a family, to have children, to experience, in our theology, something that we're really meant to experience when we're here, which I think, again, like I said at the beginning, adds a whole nother level of distress when people face infertility, because now they're not necessarily following the path of their purpose of life.
Right.
And the messages that tend to come from Mormon leadership on family planning is don't wait until you're exactly prepared. I mean, really the idea is you get married and you start having children. Now, not all Mormons follow that. A lot of people wait until they are a little further along in their studies or finish the woman's career. But a lot of Mormons are pregnant within a month or 2 or 3 of getting married and start very soon. And so another thing that happens as far as this pressure thing that we're talking about is the ward community, for some reason, finds it very much appropriate and in their business to start asking questions. So, when are you going to have kiddos? You've been married for a few years. When are the kiddos coming? Or aren't you excited to get pregnant? And so this kind of nosy community energy that tends to happen in our congregational families and adds that kind of dagger in the heart, when you're trying to have children and they're assuming that you must be waiting out of your own volition.
Right. That's right. So it's Mormons. I see a lot of people from India in my practice. They get a lot of pressure. People from Latin countries also get pressure. And so I don't know quite where it comes from in this day and age. I mean, everybody is also aware that it often takes two incomes to run a household. And it makes it a challenge for couples to figure out when it's going to be financially sound idea to start a family. So,
Yeah, which again is not usually something that is taught in Mormonism. And many, many Mormon families are one income families because there's that pressure for the mother stay home. That's her role with the children. She's the nurturer and comforter. The father's the provider. And so that even adds a whole nother layer, of stress, I think, financial stress. Not, I think there's pros and cons to that type of system. So I'm not saying that's all bad to have it laid out that way, but when it's not necessarily a choice, it's more like this is the best ideal way that's prescribed. That's
right.
an interesting dilemma as well.
Yes. Well, all of that means that when a couple finds out that one or sometimes both people are facing infertility, creates a real, like an incredible level of distress and disappointment, as well as depression and anxiety. And so, just starting there can be right away a feeling of loss. It's kind of like the loss of a dream or the loss of what one imagined life would be like, and all kinds of different things happen. Sometimes one partner will blame the other. Sometimes somebody thinks that they did something earlier in their life to cause the infertility. Sometimes things happened that they weren't aware of. They contracted a sexually transmitted infection like chlamydia for women, and it's caused blockage in the tubes. Sometimes it's endometriosis, where there's tissue growing outside of the uterus and making ovulation difficult process. So couples get not only depressed, but they can be angry because they didn't know or weren't aware that this could possibly be a problem. Sometimes couples have expressed that they feel they have married the wrong partner, maybe. That's the level of distress that they exhibit. And, and then there's all the problem solving that needs to happen as well if the couple decides that they want to go forward with pregnancy or trying to get pregnant, I should say.
Right. Yeah, and to add just kind of the Mormon aspects of that, I agree. I think it can very much, first of all, feeling either betrayed or angry with God. So
yeah,
that idea that God isn't answering my prayers, or why isn't he answering my prayers? And then those classic blame games that we get into, which is, well, I must not be blessed because maybe I'm not righteous, or I'm doing something wrong, or I've sinned in some way, or like you're saying, blaming the partner. There's something wrong with you. You're not righteous, or you don't have enough faith. These are very typical places our brains can go coming from a Mormon background.
Right. Prayers not answered, dreams not fulfilled. Well, can be very sad for the couple.
For sure. Or even if the couple doesn't do that, maybe community sometimes can say really hurtful things without maybe understanding what the impact those kinds of things can
Right.
mean.
Well, right. So they say kind of thoughtless things like, oh, you need to just keep trying, or you need to relax. Don't worry, it'll happen. Just a number of unhelpful things.
Right.
Mm-hmm.
Well, or even, again, I'm just adding the Mormon commentary here. It's like somebody will get up for fast and testimony meeting who's just had a baby, and they'll be like, we are so blessed and we're feeling so blessed that we
Yeah.
had this child, and we're so glad that Heavenly Father would bless us in this way. And so here's the infertile couple sitting there listening to all that, wondering,
Oh,
well, why aren't
yes.
we blessed in that way? And that can be really painful.
Yes, and that can cause feelings of isolation, social ostracism, not feeling welcome into adult conversation, adult social gatherings, and like you said, insensitivity.
I've had several people tell me that they've stopped attending church, particularly for this reason. That's correct.
Mm-hmm.
Yeah, it's
Yeah,
too painful of a place to go. Plus, every single meeting is about family life. It's not like you just go and learn about, oh, Jesus loves us. No, it's how are we good mothers? How are we good parents? How are we good family systems? How are we supposed to be functioning within the family? Those are very heavy, heavy lessons in most Sunday experiences for people.
sometimes when couples find out that they're infertile, sometimes they do choose to be child free. They just say, it doesn't appear to be in the cards for us, and we don't want to go through the expense or heartache of trying treatment, and we're okay with remaining child free. And that's a choice that doesn't really get honored and can make people uncomfortable.
Like the assumptions now from the community saying, well, aren't you going to adopt? Or aren't you
Right.
going to foster kids? Or aren't you going to, like you're saying, start some medical interventions, which is extremely expensive and not always covered by insurance. And who has access to that is not always everybody.
Right. And doesn't always work. Doesn't always work.
Well, so why don't we get into that? What's kind of those things that people start considering as part of how to solve this problem or try to find a solution to this problem?
Yeah, we didn't really talk about the sexual difficulties that couples face. And also, there are sexual difficulties that can cause infertility. So, one of the reasons I became interested in this topic is that I had I have a urologist who refers a lot of men to me because they have sexual issues that have no may not have a medical basis. So they may have problems with erections or delayed ejaculation, something of that nature, or low libido. And so that is a cause of infertility. Doesn't happen very often. It's like maybe a cause in 1 to 3% of infertile couples, but it does happen. And for women, there can be vaginismus, which is form of painful intercourse where penetration isn't possible, or something called dyspareunia, which is also painful intercourse. There can be penetration, but intercourse is very uncomfortable. And low libido, again, for women. These are things that can contribute to infertility. So you have to look at, in some couples, you have to look at their ability to communicate their feelings about what's going on, but then sometimes they have this other issue to resolve, a sexual issue that is preventing them from becoming pregnant.
Can you talk a little bit then about some of the things that male sexual dysfunctions that might also be part of that problem?
Yeah, so I frequently see men who have delayed ejaculation, which means that they, they're able to get an erection, they're able to have intercourse with a partner, but intercourse goes on for so long that one or the other partner gets fatigued and they stop before he ejaculates. And some men find that they can only ejaculate if they're by themselves. And then when they're with a partner, they're unable to. Other men, they're inhibited and shy about having an orgasm and ejaculating with their partner. So this can be a very frustrating issue. The medical treatment for it is kind of unpleasant, which is extracting sperm from the man's scrotum, and not a very pleasant procedure. So, of course, there's an expense with it. So, obviously, helping a man learn how to ejaculate when he's with his partner is an advantage. The way that it is treated depends on how the man presents. Some men, as I said, are inhibited and they need to feel more comfortable with their own sexuality and realize that it's a normal function to be able to have an orgasm and to ejaculate. They may need to understand their bodies better and to understand what they feel like when they're truly aroused. Often, when men are sexually inhibited, they don't understand what they enjoy that can help them enjoy the process of intercourse more, and that can facilitate orgasm and ejaculation. So that's an example of something that can happen, or something that can cause infertility, and the way that it's treated for men.
What about, did you mention erectile dysfunction?
Yes. So sometimes men can experience performance anxiety. Sometimes a man can struggle with having erections prior to deciding to become pregnant, but sometimes that develops once the couple decides that they want to have a baby, and especially if the couple is trying to time their intercourse to maximize the chance of a pregnancy, that can cause performance anxiety and also kind of make sex feel like a chore, make it not as enjoyable. The partner, the female partner, may also be tense or anxious, wondering if they're going to be able to get pregnant this time, and a man can feel that, and so they can start playing off of each other, and the act loses its sensuality. For a lot of men, once they have erectile dysfunction once or twice, it kind of feeds on itself and they get a little neurotic about the whole thing, and have a hard time unthinking their way out of where they find themselves. I mean, they sort of know, like, okay, I know my thoughts are getting in the way here, but I don't know what to do about it. So that's where sex therapy comes in, helping them understand that thoughts don't belong, that they don't need their thoughts during the sexual act, and they need to be mindful and reclaim relaxation and enjoyment. Sometimes recommending to couples that they have two different types of sex, sex for baby making, where maybe it is more a briefer encounter, and it's let's get down to business, because there's ovulation happening, or we think it's happening. And then have at other times, have like a longer, more enjoyable sensual experience. I think a lot of men do use the medications like Viagra and Cialis to help them, but medications don't work if you're very anxious, and so sometimes they need some psychotherapy to help them.
That's probably the most common issue, right? Is that I hear is, well, this has stopped being sexy now, and and the wife is like, okay, it's time, I'm ovulating, let's go. And it's right? That's not the typical foreplay type of, I guess, that people are used to. So it's a shift for sure, and that's a very normal thing to experience. What about premature ejaculation? Does that maybe have any impact?
Yes, it can. If the man ejaculates prior to starting intercourse, which is something called anteportal ejaculation. That's usually a problem. To be honest, it's usually a problem, period. But if they're trying to become pregnant, there's like a whole other layer of anxiety that goes along with that. And so, again, sometimes medication can be helpful. There are some short-acting medications. They are basically antidepressant medication under different names. So instead of Prozac, for example, it might be called Prilogy. So sometimes men don't like the feeling that they have when they're taking a medication like that. Sometimes men object to taking medication altogether. Sometimes they find out it's an antidepressant and they don't like that idea. It kind of suggests, because of the stigma of mental illness that goes along with that. And so in those cases, men do end up in my office. It doesn't happen very often, but I have had men come in with that issue. And, I want the partner there as well. Sometimes there's performance anxiety. Sometimes there are fears about intercourse and what that means and what it's going to feel like. Issues related to losing control while having intercourse, and so on. And all of these things can be discussed. And then there are different techniques, such as stop-start, or what I do is I use kind of a scaled technique where a man learns to understand his own body so that he can stay aroused without ejaculating.
Yeah, these are really kind of fascinating things that even I'm learning or being reminded of things I haven't thought of in a while as I listen to you. And I think of young couples dealing with these issues with probably very little knowledge of their own bodies, and then the barrage of information that probably comes as they start understanding things through the medical field. And such important things to know about possibilities. And one thing I want to go back and revisit, because I just kind of listened to you talk about women and then went to men, but let's get more into some of the issues that you talked about. Can you explain a little bit about, more in detail, the differences between vaginismus and dyspareunia, and maybe how they are treated and what types of issues come up with them?
Right. So all of these sexual pain disorders they're gathered together under one diagnosis, which has this long name that I think is intimidating and kind of unfortunate. But they are genitopelvic pain penetration disorders, and basically that just means painful intercourse. And so vaginismus occurs when the pelvic floor muscles are overly tight, overly tense. And that can happen for many different reasons. It can happen because that happens to be where a woman holds stress in her body. It can be because of psychological fears about getting pregnant, sometimes about labor and delivery, sometimes irrational fears about contracting an STD. It can be from trauma, although that's not actually typical. And often when women with vaginismus go into the physician's office or the gynecologist's office for help, what the gynecologist will do is say, well, you just need to relax. And often that's because the gynecologist was able to do a pelvic exam. But, sometimes that pelvic exam was very painful or difficult for the woman. Sometimes it's easy, but that doesn't mean that under certain circumstances, a woman can relax her pelvic muscles. So if it's a medical treatment, maybe she can relax those muscles. But if it's something sexual that's happening, she's tense. Other things can be the body image. It can be cultural prohibitions about sex. All kinds of things can contribute to vaginismus. The other condition is dyspareunia, which is painful intercourse. Of course, these two things kind of go together sometimes. Intercourse is painful, and now the woman develops vaginismus. So that can happen. But dyspareunia often occurs because a woman has, for example, endometriosis, and those tissues can cause painful sensations during intercourse, especially during thrusting. Sometimes there's another condition like irritable bowel syndrome. So pelvic floor muscles are kind of inflamed all the time. And so intercourse is uncomfortable. And I don't know anyone who can't understand a woman who's having painful intercourse would want to avoid it and maybe develop, in both these cases, whether women have vaginismus or dyspareunia, to develop low libido, low desire. These conditions tend to be embarrassing, and couples often wait a long time before they go to get treatment. It's often when they want to have a baby that they come in for treatment. So,
meaning that there's been already a history of painful sex for a while.
Yes, exactly. There's a history of painful sex, but either a woman, unfortunately, will just kind of put up with it, or they'll find other ways to have sexual pleasure. But then, it's time to have a baby. They want to get pregnant. And, they try, but it's not happening. So that's when I often see women at that point. The clinic that I am co-located with is filled with pelvic floor physical therapists. And so they work with a lot of women who have these conditions, helping them learn how to relax their pelvic floor muscles. What I do is I support their work and I support the woman by helping her if she has any psychological fears about sexuality, about the act of intercourse, any fears related to being pregnant, or even labor and delivery.
Can you talk about that a little bit? Because there's a difference between wanting to have a family and a child versus maybe also at the same time having that fear of pregnancy and labor. So those can coincide.
Yes, definitely. Yes, I've worked with a number of women who have expressed deep fear about especially labor. So in one case, the woman had witnessed a birth process, a delivery that went wrong. And, she saw her relative being wheeled out for emergency C-section, and everybody was in a panic. And, it was a very unpleasant thing. And she was quite traumatized by that. So we had to work through the trauma that she experienced. In another case, a woman had been abused when she was young. And for her, she said that she just couldn't face the pain or the possible pain of labor. And I actually worked with her gynecologist to have a scheduled C-section, and that's what she wanted. Women have fears about labor. They do. I think that's natural to be afraid. It is can be a painful process or a long process. But most women, they figure, hey, you know what? Millions of women have gone before me, and they've gone through this process, and I can do it too. And they have appropriate, maybe family support, maybe they have sisters or cousins or friends who have already delivered. So they know what to expect or how to prepare. Some women are more isolated, maybe don't have sisters and so forth. Maybe their family lives far away, and so that's scary for them. Those fears can lead to, not wanting to get pregnant or being ambivalent about wanting to get pregnant. It's sort of like, well, I want to have a baby, but I'd like to skip the entire 9 months and just have one delivered to me via the stork or something like that, right? I was like, well, that's not going to happen, and they know that there's some irrationality there. So, it's facing their fears and figuring out what they're going to do about it. And that can be a big part of the treatment.
Are there fears that tend to come up on the male perspective as far as why, other than having erectile dysfunction because now there's this pressure to have sex, but I'm talking about fears of actually having a child and things like that that might be getting in the way.
Yes. Sometimes men are ambivalent. And the thing is, because the urologist is referring to me, when I talk to them on the phone, I'll say, do you want to come in with your partner? And often the answer is no, which I think is kind of interesting. This is a couple trying to have a baby, and that's fine. I will, see him one-on-one. Um, Often in the first session or two, they will express that they're deeply puzzled, that this is something that they really want. And in an early session, it will come out that there is ambivalence. Sometimes it's because they already have started one family. This is a second marriage, and they're being sometimes a little bit pressured to start a second family. Or even if they agreed that they want to start a second family, they're worried about what all of that is going to look like. How will everybody get along? How will they be able to give attention to children from the first family? So that's an example of ambivalence. Sometimes it's ambivalence about the relationship itself. I have had men come in and say, you know what? I don't know that I want to have, I'm married, and now that we're thinking about having a family, I don't know that I want to have a child with this person. And that's a very distressing thing for them to admit and to find out. Sometimes I recommend couples therapy so that they can work out. He has to be honest with his partner and say, some things maybe need to change before we commit to having children together. But those are the kinds of things that can contribute to sexual problems. Something that I'm worried about in saying that is that, you might have a listener that says, aha, see, I know there's something, my husband is thinking something and he's just not telling me.
Right.
And so, start to pry. But I would highly recommend that you do not do that, because when we pry, the partner becomes defended, and you probably won't get anything out of the conversation. And not only that, but as I said, men often come in and they express that they can't wait to get pregnant. It is a really difficult thing to admit, sitting all by himself with nobody else to listen except the therapist, that there's a problem. So don't pressure. Suggest going and talking to somebody, whether it's an elder or a friend or a parent, a grandparent, something like that, and try to figure out what's going on. What do they fear? What are they thinking?
Well, and I'm guessing what you mean by pry versus have a discussion. It's something to be like kind of passive aggressive about asking versus, hey, if there's anything here that we're having a problem with that you don't know how to talk to me about, I want you to know I'm
Yes.
open. Those are very different conversations.
Yes.
But then also being able to hold your own anxiety as maybe some of that stuff comes up.
Right.
And then
Right.
when you talked about, men being super excited to have a baby too, and then feeling their own distress around this, I wonder how much we really give space for their distress versus seeing this more through a female lens, because she's the one that can or cannot get pregnant, kind of classic rhetoric. And
Yeah.
so we're sad for the kind of loss of motherhood, and motherhood is such an important part, of a woman's identity, but so is fatherhood for men. And I just wonder if sometimes they get gypped a little bit on how much attention we spend on the sadness they're experiencing.
Yeah, so I'm looking at research, and what I'm finding is that men don't seem to be as distressed. I mean, some men are, but the majority or significant number of men are not distressed about infertility and kind of feel like, well, whether we have kids or not, we're together and it's fine, and we'll try or we won't try, and life will go on, because I don't think as much of their identity is caught up with becoming a parent. So that leads, as you might imagine, that can lead to some interesting discussions for couples, because, she's extremely distressed and sad and depressed and anxious. And he might be like, well, yes, it's a bummer, but we'll be okay. And as you know, that kind of response doesn't go over very well for women when they're
Right.
upset. I'm just thinking about myself, and that doesn't work very well to just kind of be placated. I think some men do recognize that their partner is distressed and sad, and that's what makes them sad, is watching their partner go through this process. Um, so it's not actually so much the sadness of not becoming a father, but the sadness of watching their wife being upset and dismayed about the infertility.
Right, right. And then just remembering that we're talking in generalities here. So as people listen, that they understand that if we're not talking about your particular experience,
Yes,
that's perfectly natural. These are generalities, what a lot of people tend to talk about or feel. Okay, so let's get into then some of the things that couples need to negotiate during this time that can also affect their intimacy and their relationship. So in a sense, that's kind of what you've been talking about, different attitudes about infertility. It might be one partner who is more distressed about it than the other, or who's more impacted emotionally than the other. What about you're facing now a variety of options? Are we going to go spend money on in vitro fertilization, right? Are we going to try hormonal therapies? Are we going to try adoption? Are we going to foster? I mean, there's a lot of, are
there's
we,
a
to your point, are we not going to have children? Are we going to make that decision? So that's tough stuff.
Yes, that is very tough stuff. I mean, sometimes people are just limited in what they can do because of finances. That is, that's very distressing. But sometimes those couples will adopt, or they will foster children. Some couples will go to the ends of the earth. Where I live or practice, I have an office in Newport Beach. And Newport Beach is one of the wealthiest communities in the country. So there are people with millions of dollars to spend on treatments. So that's the other end of the spectrum. And there's kind of the sky is the limit. But it's like, at what point do you say enough? Enough. We've gone through this roller coaster how many times? Can we tolerate? Can our marriage, can our sanity tolerate, so much treatment? So I've seen both ends of the spectrum.
Especially when treatments don't take, and the incredible amount of distress that is, right? Like the anticipation and the hope and the finances, and then
yes,
then,
I mean,
then a negative result.
Right. So sometimes, couples will say, okay, we have the money, or we have the resources, we're going to try X number of times. And the pressure, when it doesn't take the first time, second time, let's say the third time is going to be, it's this time or it's not going to happen. And the stress and the anxiety, the anticipation of trying in vitro, for example, and then waiting to see if it took, and the anxiety of that period, and then having to cope somehow with with an unhappy outcome. It's always a possibility. So couples really need to support one another. They need to find, hopefully, friends that, or family members who can be supportive, and also to access support groups. So, of course, Resolve is the largest organization, and they have support groups all over the United States. And so people can go to support groups to talk about their experience. Sometimes those support groups, and this is always true with support groups, I have had a few women in particular not do well with the support group because, the same thing as what you talked about with church. Like, you feel like, okay, we're all in the same boat, and then someone gets pregnant, and then maybe one person gets pregnant, and that's okay, but then another one and another one. And it's just stressing for somebody who's attending that group. So That's why sometimes individual or couples therapy is a really good idea. It doesn't have to be, ongoing for, the next 10 years you're in therapy over, infertility. But I think sometimes a few sessions to get things in perspective, to get encouragement, to identify support for yourself, and to have a safe place to have difficult conversations. That's what I think many couples can benefit from.
What about managing in-laws? I'm
Oh,
sure they probably many
yeah,
times can have a lot of, I guess,
yeah,
suggestions, right, as to how you
right,
should
right.
be dealing
Yeah.
with this.
I always say the smart in law keeps their lips zipped unless they are asked for advice. And so, setting boundaries with in laws can be really important. It's to say, you know what, if we appreciate support from you, and this is what support looks like, and this is what it doesn't look like. And hopefully, you have a set of parents or a parent who will listen. And if not, then I think limiting the amount of information that you give to a parent who can't handle it or reacts inappropriately is the way to go. Sometimes in-laws or sets of parents disagree about what kind of treatment, how much treatment, when treatment should stop, and so forth. I think the couple needs to, again, say thank you for your input, but ultimately, this is a decision that the two of us need to make, and we hope that you will respect our wishes.
How about just any strategies for socializing with other couples, especially, their friends are having babies and being invited to a shower of your
Yeah.
peers or just some of these painful events? And what are some things and strategies that a couple could maybe think about?
Yeah, well, you know what? I think they have to check in with themselves when they're invited to something, and say a shower, a woman's invited to a baby shower, to really check in with herself and say to her, ask herself, how am I feeling psychologically right now? It's unfortunately rather common to have miscarriage as a woman gets older. So even if a treatment takes, there's always that possibility. And so, if she's recently had a miscarriage, maybe she is not in a place psychologically that she can go to a baby shower and enjoy herself, or just, be able to tolerate whatever painful feelings might come up, or jealous feelings, whatever. And I think in those cases, that to call the friend or call the host or hostess, and to have a conversation and just say, look, you know what, I am happy for you, and I do want to get together, but right now at this moment I'm not in a place where I think I can participate. And I think the important people in one's life will be understanding of that. And you can also always send a gift. That doesn't preclude you from going online. You don't have to go into the baby store, going online and ordering a gift, or even asking a friend to order a gift and send it off.
Send a check.
A check, a gift card. Gift cards are always good. Thank
Right.
you. I'm kind of old school. And I think it's handle things on a case by case basis. If a friend gets bent out of shape, I think at some point you might say, well, is this a friend? But hopefully you don't have to go to that place.
Yeah.
You
I
have
think
friends.
most people would be very understanding, and
Yeah.
it's perfectly reasonable to set boundaries according to where you're at. Yeah.
Yeah.
So let's close off then with maybe this idea about, you kind of touched on it, but we tend to become overly focused on the things that are obviously very much we're thinking about on a regular basis. So couples can become overly consumed by these fertility issues and And oftentimes other aspects of their relationship are ignored or not talked about or not thought about very much.
Yes.
So, May, what are some ways that couples can renegotiate their own sensuality, their own interests, other things, so this doesn't become like the only huge elephant in the room?
Right. Yeah. So, that happens with many things for couples, I think. Some of the things that I suggest is kind of reminds me of couples when one has a medical illness, for example, is to send the problem on vacation, or send the problem to a room in the house or a closet and lock it away for the evening or for the weekend or something like that. In other words, set some boundaries and say, you know what, we need to take a rest from the problem and we need to enjoy ourselves or we need to do other things. And I always say, it's interesting about problems. They don't go away just by themselves. So saying, okay, let's take a break for the evening or a day, a weekend, something like that. Let's take a break from this. The problem will be there when you go back to it. So, you know, and just give it a rest. So, and I think a lot of couples respond well to that suggestion. I think, to make sure that you schedule fun things to look forward to, fun distractions. I think doing things that make your relationship feel stronger, whether it's making sure that you're going to church together or engaging in some kind of recreational activity that you both enjoy, like hiking or something like that. And then as far as sex goes, like I said, to make sure that you have set aside time when you're going to have sex just for the sake of sex and not for the purpose of procreation. So that's the kind of the joke is like, procreate when procreation meets recreation and they bump up against each other, it can cause problems. But you don't have to allow that to happen. You can say, you know what, we have different things going on, and we're going to give each kind of experience its own, have our own way of approaching it. Some couples, on the other hand, some couples approach baby making in a very sensual and spiritual way. It just really depends on the couple. Some couples want to set up candles and have flower petals on the bed or whatever when they're doing baby making sex. And some are going to be, you know what, it's just not that way. And, it's okay. You just have to have the conversation, to have open communication, to say, hey, this is what I notice is going on. This is how it's making me feel. This is what I think we should try. What do you think? And take the conversation from there.
I think that's been a great discussion, a lot of really great information, and I can't thank you enough for coming on. I know that we have talked about making this really a 3-part series where we're going to talk about infertility being our first podcast, but then we're going to talk about sexuality while pregnant and then sexuality after the baby is born. And these are, I think, such important things to be talking about and having normalized. There are times that many people struggle with, or the brunt of many jokes that are out there, because we all kind of know that there are struggles that come up with those types of topics. But I just love to give you the last word and leave us with your final thoughts about, the impact of infertility and sexuality and couplehood.
Well, first of all, I really appreciate your giving me this forum to talk about these issues. I think that couples that are facing infertility often feel isolated and alone, especially when their sex life is not the way they'd like it to be, or the way you would expect it to be for a couple that's trying to become pregnant. And I think those couples need to know that there is help available. Going to, say, the ASET website, AA, S like Sam, E, C like cat, T like Tom.org. as a good place to find a sex therapist, or ask your physician. Sometimes they can refer you to someone that can be helpful to you as well.
Well, wonderful. Thank you so much for your time, Stephanie. It's always a pleasure.
Thank you, Natasha.
We took the long road home, turned minutes into miles, and as the evening traveled on, the sunset bathed your smile. We stopped beneath the desert stars, wrapped in each other's arms. Was as simple as I love you, an ordinary, extraordinary truth.
A trail with tears, pain and sorrow too.
But through every storm we traveled on, like lovers do. And if sometimes we fell apart, we always came back home. Was as simple as I love you, an ordinary, extraordinary truth. Some people say love is blind and forever is too long. But I see your eyes in every sunrise. Can't imagine life alone. Let's take the long road on together until we're gone. Want you by my side till the day I die and into the beyond. It's as simple as our love is. That's how I wanna go, all wrapped up in the arms of our extraordinary, it's nothing ordinary love. Ordinary. No, it's extraordinary.